Gentlemen, I already know what's going through your mind right now. You read that title, you looked at it twice, and somewhere between confusion and curiosity, a voice in your head said, "A toothbrush? She's talking about a toothbrush? The same thing I use twice a day to clean my teeth?" I hear you. And honestly, if I were sitting where you are right now, I'd probably be thinking the exact same thing. It sounds unusual. It sounds like something that belongs in a late night infomercial, not a medical discussion. But here's what I need from you. I need 5 minutes. Just 5. Give me 5 minutes of your honest attention. And I promise you, by the end of this video, you're going to look at that toothbrush sitting in your bathroom cup and see it completely differently. Because that simple, everyday tool that you've been using your entire adult life to maintain your oral health, it has a second purpose that almost no one has ever explained to you. And when you understand the anatomy behind it, when you understand exactly which nerve pathway we're targeting and why, it won't sound unusual at all. It will sound obvious. You'll wonder why nobody told you sooner. We're talking about a specific biological response, a real, measurable, physiological reaction that happens in your body in under 30 seconds when you apply the right kind of gentle stimulation to a very precise area. Not a supplement, not a pill, not an expensive device you order online at 2 in the morning. A toothbrush, one you probably already own. Now, I'm not here to make wild promises. I'm not going to tell you this replaces medical care or that it works for every single situation. What I am going to tell you is that the science behind this is grounded in anatomy. It's based on how your nervous system actually communicates with your circulatory system. And for many men, especially men over 60, who have noticed that their body doesn't respond the way it used to, this technique addresses the exact mechanism that's been quietly shutting down. My name is Dr. Jocelyn. I've spent the last 5 years in clinical practice, working specifically with men in midlife and beyond, helping them understand their bodies, restore confidence, and reclaim the kind of physical vitality they assumed was permanently gone. And today, I'm going to walk you through something that I've shared with patients privately for years. But there's a catch, and it's a significant one. You need to watch this entire video because there is a precise method here. If you stimulate the wrong spot, if you use the wrong pressure, if you rush through it, you will feel absolutely nothing. Or worse, you could actually desensitize the area and make the problem harder to fix. So stay with me. Close the other tabs. Put the distractions aside. What we're covering today could genuinely change how your mornings feel. Before we get into the anatomy, if you're a man who values honest, calm, medically grounded information about your health, hit that subscribe button right now. This channel exists because I believe men deserve better conversations about what happens to their bodies as they age. And drop a comment below telling me where you're watching from. I see comments from every corner of the world, and it reminds me every single day why this work matters. All right, let's get to work. To understand why this technique works, we need to change how you think about what's happening inside your body when firmness occurs. Most men think of it as a plumbing issue. Blood goes in, things get firm, end of story. And that's partially correct. Blood flow is absolutely essential. But here's the piece that almost nobody explains to you. Blood doesn't just decide to flow somewhere on its own. Your heart doesn't randomly choose to send extra circulation to your pelvic region. It needs a command. It needs a signal. And that signal travels through your nervous system. Let me give you an analogy that makes this crystal clear. Imagine your body as a house. The blood flowing through your vessels is the electricity. It's the power supply. Now, you can have a perfectly functional power grid running through every wall of that house. But if the light switch on the wall is broken, if the wiring between the switch and the bulb is frayed or disconnected, it doesn't matter how much electricity you have available. That light is not turning on. For many men past 60, the power supply is still there, the blood is still available, the vessels still function, but the switch has gotten sticky, the wiring has gotten quiet, and that's why things stopped responding the way they used to. So, what is this switch? Where is this wiring? Between the base of the scrotum and the back passage, there's a small area of skin that most men have never paid attention to in their entire lives. Medically, we call this the perineum. You probably wash over it in the shower without a second thought. Most men don't even know it has a name, let alone that it's one of the most neurologically significant areas on the male body. Directly beneath that skin sits a nerve called the pudendal nerve. If you remember one thing from this entire video, remember that name, the pudendal nerve. This is the master communication line between your brain and your entire pelvic region. This single nerve pathway is responsible for sensation, for muscle contraction in the pelvic floor, and most importantly, for triggering the cascade of signals that tells your brain to open the blood flow gates and create firmness. When you're younger, this nerve fires easily. The signal is loud and clear. Your brain receives the message instantly and responds without hesitation. That's why firmness happened almost automatically when you were in your 20s and 30s. The wiring was fresh, the connection was strong. But as years pass, two things happen gradually. First, natural blood flow to the pelvic region decreases slightly. That's normal aging. Second, and this is the part most doctors never have time to explain during a 15-minute appointment, that pudendal nerve gets quieter. I call it neural dormancy. The nerve isn't damaged. It isn't dead. It's just understimulated. Maybe you've been sitting at a desk for decades. Maybe physical activity has decreased. Maybe you simply haven't activated that specific area in years. The signal becomes like a radio station with too much static. The brain can't hear the request clearly, so it doesn't send the blood, and you wake up feeling like your body has given up on you. But it hasn't. The nerve is still there. The pathway is still intact. It just needs a louder, clearer signal. And this is precisely where the toothbrush comes in. The bristles of a soft toothbrush create a very specific type of tactile stimulation. Not too broad like your fingertips, not too sharp like a pointed object. The texture and the gentle motion create a frequency of stimulation that is uniquely effective at waking up the pudendal nerve without overwhelming it. It cuts through the static, it clears the line, and it sends a signal to the brain that is loud enough to trigger a response. This isn't guesswork. Perineal nerve stimulation has been studied. We know that this area responds to gentle, consistent, tactile input. The toothbrush simply happens to be the most accessible, affordable, and effective tool for delivering exactly the right kind of stimulation. It's not magic, it's anatomy. And once you understand the anatomy, the technique makes perfect sense. Now, before I walk you through the exact step-by-step method, I need to protect you from yourself. And I say that with genuine warmth, because I've seen it happen dozens of times. A man watches a video like this, gets excited, rushes to the bathroom, tries the technique with no preparation, and comes back saying it didn't work. And when I ask what happened, I find out they made one of 4 very specific errors. These mistakes don't just make the technique ineffective, they can actually work against you. So let's count them down so you can avoid every single one. Mistake number 4, using too much pressure. This is by far the most common error, and it comes from a completely understandable instinct. You think, if gentle stimulation is good, firm stimulation must be better. So you take that toothbrush and you press it into the skin like you're trying to scrub a stain out of a countertop. Please don't do this. The pudendal nerve sits close to the surface. It's designed to respond to light, nuanced sensation. When you press hard, you bypass the sensory receptors we're trying to activate and instead trigger pain receptors. Your body interprets that as a threat. It goes into protective mode. Blood vessels constrict. Muscles tighten. You get the exact opposite of what we want. Think of it this way. If you wanted to wake someone up gently from a nap, you'd tap their shoulder softly. You wouldn't punch them in the arm. Same principle. We're waking up a nerve, not attacking it. Mistake number 3, using the wrong type of bristle. Go to your bathroom right now and check the packaging on your toothbrush. If it says firm or medium, set it aside. Do not use it for this technique. The skin in the perineal area is significantly thinner and more sensitive than the skin on your gums, your hands, or anywhere else you're used to applying pressure. Firm bristles will create irritation. Irritation triggers an inflammatory response. And inflammation shuts down the parasympathetic nervous system, which is the exact system we need active for arousal to occur. You need a soft or extra soft bristle toothbrush. If you don't have one at home, pick one up. It's one of the most inexpensive investments you'll ever make in your health. Mistake number 2, going too long. I've had men tell me they tried this technique for 8, 10, even 15 minutes. Gentlemen, that is far too long. Here's why. When you stimulate a nerve continuously for an extended period, the nerve adapts. It stops registering the sensation as novel. The signal becomes background noise, like the sound of an air conditioner that you stop noticing after a few minutes. You've essentially bored the nerve into silence. This technique is designed to be a spark, a quick, potent activation, not a marathon. 20 to 30 seconds is the target. That's it. Short, focused, intentional. In and out before the nerve has time to adapt. Mistake number 1, starting in the wrong mental state. This is the silent killer, and most men never even realize it's happening. If you attempt this technique while your mind is racing, while you're stressed about finances, worried about a health issue, replaying an argument, or even just mentally distracted, it will not work. And the reason is purely biological. When your brain is in stress mode, your sympathetic nervous system is dominant. Your body is producing cortisol and adrenaline. And adrenaline is the direct biological enemy of the response we're trying to create. Adrenaline constricts blood vessels. It diverts blood away from the pelvic region and sends it to your muscles so you can run from danger. That's a survival mechanism, and it overrides everything else. You can stimulate the perineum perfectly. You can use the right bristles, the right pressure, the right timing. But if your brain is running a marathon of worry, the signal will hit a wall. The blood will never arrive. You have to be calm. You have to be present. And that's exactly why the breathing technique I'll share in a moment is so critical. All right, you know the science. You know what to avoid. Now let me walk you through the exact method, step by step. I want you to visualize this as I describe it so that when you try it later, your body already knows what to expect. I call this the 30-second spark. Step 1 is to create the right environment. Privacy matters, not because there's anything to be embarrassed about, but because privacy allows your nervous system to fully relax. When you feel safe and undisturbed, your parasympathetic system engages naturally. That's the state we need. You can do this standing, sitting on the edge of a sturdy chair, or seated comfortably where you have easy access to the area between your legs. Make sure the room is warm enough that your body isn't tense from cold. Step 2 is to locate the target area. Before you pick up the toothbrush, use your fingertips first. Reach between the base of the scrotum and the back passage. You're looking for that soft bridge of skin. It's roughly the size of a large coin. You might feel a slight natural ridge, or it might feel smooth. Either is normal. This is the perineum. This is where the pudendal nerve is most accessible from the surface. Take a moment to familiarize yourself with exactly where it is. Knowing the precise location makes everything that follows dramatically more effective. Step 3 is to prepare the tool. Take your clean, soft bristled toothbrush. Make sure it's dry or slightly warmed. Running it under warm water for a moment and then patting it mostly dry works well. Cold bristles against warm skin can cause the muscles to tense reflexively, which is the opposite of what we want. Step 4 is to make contact. Place the bristles gently against the perineal area, and I want to emphasize the word gently. Do not press. Do not push. Simply rest the bristles against the skin so that you can feel the texture making contact. The weight of the toothbrush itself is almost enough pressure. That's how light we're talking. Step 5 is the 2 motions. This is the heart of the technique. You're going to alternate between 2 specific movements. The first is what I call the microcircle. Move the brush in tiny circular motions, no larger than the size of a small pea. Light, feathery, almost ticklish. Do this for about 5 seconds. The second is gentle tapping. Lift the bristles slightly and tap them softly against the skin in a rhythmic pattern. Do this for about 5 seconds. Then alternate. Circle for 5, tap for 5, back and forth. The reason for alternating is important. If you use only one motion, the nerve adapts to the pattern and stops responding as strongly. By switching between 2 different types of stimulation, you keep the signal fresh. You keep the nerve engaged. Each switch is like a new wake-up call. Step 6 is to count to 30. That's your window. 30 seconds of focused, alternating stimulation. While you do this, close your eyes. Focus entirely on what you feel. Visualize that nerve pathway lighting up. Visualize the signal traveling up your spine, reaching your brain, and your brain responding by opening the gates of circulation. Mental focus during these 30 seconds is not optional. It's part of the technique. Your brain needs to be listening for the signal in order to act on it. Step 7 is timing. This is a priming technique. It's designed to be used 2 to 5 minutes before you need the response. If you do it 30 minutes beforehand, the activation will have faded. If you do it too far in advance, you'll miss the window. Think of it as warming up an engine right before you need to drive. Now, if you stopped here and just used the technique I described, many of you would notice results. A warmth in the pelvic area, a tingling sensation. Perhaps the beginning of a response you haven't felt in a long time, but I want to give you the piece that turns this from a useful trick into something genuinely powerful. And it involves something you do every moment of every day without thinking about it: breathing. Remember when I explained that stress and adrenaline are the enemies of the response we're trying to create? Deep, intentional breathing is the most effective way to shut down that stress response in real time. Here's what I want you to do while you're performing the 30-second technique. Inhale slowly through your nose for a count of 4. Breathe deep into your belly, not into your chest. Your stomach should expand outward like a balloon filling with air. Hold that breath gently for a count of 2. Then exhale slowly through your mouth for a count of 4. Let your whole body soften as you release the air. Repeat this throughout the entire 30 seconds. Now, why does this matter so much? When you breathe this way, you manually switch your nervous system from sympathetic dominance, which is stress mode, to parasympathetic dominance, which is the state your body needs to be in for arousal to occur. Your heart rate slows, your blood vessels dilate, cortisol levels drop, and most importantly, your body becomes receptive to the signal that the toothbrush stimulation is sending. You're working from 2 directions simultaneously. The toothbrush is waking up the nerve and sending the signal upward to the brain. The breathing is calming the brain and allowing it to respond to that signal by sending blood downward. When these 2 things happen at the same time, the effect is significantly stronger than either one alone. There's another benefit to the deep breathing that men often don't expect. It produces nitric oxide in the body. Nitric oxide is a natural compound that relaxes the walls of blood vessels, allowing them to expand and carry more blood. So the breathing isn't just calming your mind. It's actually biologically improving the blood flow that the nerve stimulation is requesting. This combination, gentle perineal stimulation paired with intentional deep breathing, is one of the simplest and most effective approaches I've ever shared with patients, and it costs absolutely nothing. I want to step away from the clinical language for a moment and talk to you as one human being to another. I know that watching a video like this takes courage. I know that even clicking on the title required you to push past something, maybe embarrassment, maybe skepticism, maybe a quiet fear that nothing is going to work and you're just setting yourself up for another disappointment. I see you. And I want you to know that what you're feeling is shared by millions of men who will never admit it out loud. In my 5 years of working with men on these issues, I have sat across from every kind of man you can imagine: quiet men, proud men, men who built businesses and raised families and served their communities for decades. And when they finally find the words to talk about what's happening with their bodies, there's almost always the same look in their eyes. It's not just frustration, it's grief. They're mourning a version of themselves they think is gone forever. And every single time, I tell them the same thing I'm telling you right now. You are not broken. You are not declining into irrelevance. Your body has not betrayed you. What's happened is that a communication pathway got quieter over time, the way any system does when it doesn't receive regular maintenance. That's not failure. That's just biology. And the beautiful thing about biology is that it responds to input. When you give your body the right signal, it answers. Maybe not as quickly as it did at 25, maybe not as dramatically, but it answers because the machinery is still there. The wiring is still intact. It just needed someone to show you where the switch was. There is no shame in understanding how your body works. There is no shame in using a simple tool to support a natural function. The only real loss comes from giving up on yourself because you felt too embarrassed to try. Intimacy is not a luxury that expires at a certain age. It's a fundamental part of human connection. It strengthens your bond with your partner. It reduces stress. It supports cardiovascular health. It gives you a sense of vitality and presence in your own life that nothing else quite replaces. You deserve to have that. At 60, at 70, at 80, for as long as your heart is beating. So here's what I want you to do. Tonight, walk into your bathroom, find a soft bristled toothbrush, close the door, take a deep breath, and invest 30 seconds in yourself. That's all I'm asking. 30 seconds. You have absolutely nothing to lose and potentially everything to gain. And then I want you to come back to this video, scroll down to the comments, and simply tell me how it went. You don't need to share details, just a few words. Because when you share your experience, you give hope to every other man reading those comments who hasn't found the courage to try yet. Your words might be exactly what someone else needs to hear today. If this video helped you, hit that like button. It tells the algorithm to show this to more men who are searching for answers. Subscribe to this channel so you don't miss what's coming next, because we're building something here. A community of men who refuse to accept that aging means giving up. I'm Dr. Jocelyn. Thank you for giving me your time and your trust today. You are not done. Your vitality is not gone. It's right there, waiting for you to send the signal. Go send it. Take care of yourself. I'll see you in the next one.